There's mini tummy tucks, there's also regular tummy tucks, and there's what's an extended tummy tuck. And now, in the last 10 years, we're seeing more and more people losing dramatic weight from morbid obesity. So that third category has been basically created the last 5 years of the extended tummy tuck. Basically, it's a tummy tuck that goes further back. It lends itself that you can take out the extra skin on the sides as well as the front. The thing I like the most about the tummy tuck, without a doubt, is the self-esteem boost that a lady who's lost maybe 40 or 60 pounds, has loose skin, is still trying to look good in a bathing suit, and it has no other alternative but to get the surgical operation done. When you do that, they actually lose a lot more weight because the skin actually weighs more than fat. So I've seen patients who come to me who've lost 40 pounds and they're stuck. They can't lose any more weight, and I tell them you need a tummy tuck. You don't need to go to your trainer again. You need to basically have the skin removed and the muscles tightened. And when I explain to them why they lose the weight, and the reason why they lose more weight is I tighten all their internal muscles, the rectus muscles that end up making them eat sensibly. So when they go for the first meal after their tummy tuck, they get full very quickly. If you do liposuction, you won't have that effect. You'll just keep eating and get heavier and heavier. So that's why I think a tummy tuck is almost a life-changing surgery. And I like to start with that as far as when I have a patient who's lost a dramatic amount of weight, I start them off with a tummy tuck first so that I can get them to lose another 30 pounds. Then later I'll introduce maybe doing a breast surgery on them or a face surgery, because had I done it the same day, those two areas would have been different anyways. So I don't like to do commando operations where I do a tummy tuck with another operation. In fact, more and more now, that's almost becoming medical malpractice. I think it makes good sense to separate these operations and have the recovery time be less so they can get their normal life back quickly, and then do the secondary operations on long weekends, which we have several of them throughout the year. As far as the recovery for a tummy tuck, I usually recommend 1 week. It would be nice to have 2 weeks off, but the reality is most people just ask for 1 week off, plus or minus 1 day. You will be a little hunched forward when you do go back to work, but nothing terrible where you can't get in and out of the car or walk around and take care of your own affairs.